Hello doctor, we are from group 5 and now this is the video presentation which is about movie review Melancholia. My name is Su Cheng with number matric 277074. For now, I'm going to start our video presentation. The first part of this video presentation is psychological issue. The first psychological issue is about Justine, a descent into darkness. Justine emotionally aloof and finds it difficult to relate to others around her. It evidences that she is apathetic and emotionally indifferent, which may indicate a deeper psychological conflict. She isolates herself from her friends and family and becomes more reclusive. Justine's emotional anguish takes center stage during the wedding party, leading to a breakdown that ruins the image of happiness. The approaching apocalypse increases this natural sorrow and acts as a trigger for her emotional breakdown.
Hi, doctor and everyone. I'm Hong Wenhui, metric number 279956, and now I'm going to continue the presentation with the second main character in this film, which is Claire, sister of Justine. She struggles from the severe anxiety and existential dread. Throughout this film, her persona has shown the psychological implication of intense anxiety and fear in facing imminent disaster. Even though Claire is a positive-minded person, there is still one thing that she could not handle properly, that is, life could end suddenly. Indeed, she reacts to this with fear and anxiety. Claire's anxiety starts to worsen as she tries to face the impending catastrophe with a sense of normalcy and control. Her anxiousness reflects in a painstaking preparation and attention to details as she tries to maintain order in the disaster that is about to happen. Her anxiety-driven breakdown is the result of her deep-seated psychological misery, which is highlighted by her fear of the unknown and her failure to handle the impending catastrophe.
Hi, my name is Joy Cham Jawan and my matrix number is 277033, and now I'll be discussing about the types of disorders that can be seen from this movie, Melancholia. So Melancholia is a film that portrays our main disorder, which is depression, through the character Justine. So she has a deep sense of depression, which is characterized by introspection, deep sadness, and also fear. So Justine's signs of depression are evident through her introvertness, societal expectation, and also constant feelings of emptiness. And she struggled to find fulfillment in her life, even in conventionally enjoyable occasions. So this is a common aspect of depressive disorder, where individuals they find it hard to find pleasure in things that and activities that they used to enjoy. And her depression leads to isolation as she withdraws from social gatherings, including her husband, her family, and creating emotional distance, which is a common symptom of depression. Next, we have Claire, which is Justine's sister. So in this film, it portrays her of being someone who is desire of control and order in her life, but it is disrupted by the impending catastrophe. So this is a common trait of anxiety disorder, and Claire also initially dismisses Justine about the severity of the situation, which can be seen as a common coping mechanism for anxiety. So not only behavioral symptoms, Claire also has physical symptoms such as nausea, unease, shaking, which can be seen throughout the film. So now we know that these symptoms are not only behavioral but also manifest in physical form, which highlights the complexity of anxiety disorder.
My name is Nordini binti Muhammad Norbi and my number matric is 2815 and 48. So today I would like to present 3.0, which is start with diagnosis. Major depressive disorder MDD is typically the first diagnosis of melancholia depression. A diagnostic examination is performed by a medical professional before making a depression diagnosis. A complete history and physical examination, as well as a blood test to rule out any underlying medical issue, are all part of this evaluation process. A doctor or other medical expert may diagnose the patient with depression with melancholic characteristic if they show a lengthy duration of severe melancholia symptoms.
Most people who face melancholia depression will experience symptoms such as a mental disorder or seeing a slow movement. Half of them will be slow in speech, thinking, and movement. The body feels tired or possibly has no energy at all, finding it difficult to sleep and will wake up early next morning or oversleep. They often show a little expression or easily lose the feeling of fun and happiness for no reason. Also experience slimness and weight loss due to the loss of appetite. Some of them face appetite swing, which increase their appetite. Difficulty concentrating on people around them. Feeling of hopeless, strong guilt, anxiety and suicide thought. Next, as for anxiety disorder, often linked with individual who has mental problems such as depression or substance misuse. Severe anxiety will need a person to be diagnosed by a psychiatrist known as a medical doctor. Discussion feelings, thought and behavior in order to help pinpoint the diagnosis process is involved in the psychological evaluation. A lot of doctors will use the Diagnostic and Statistical Manual of Mental Disorder (DSM-5). Common symptoms shown when experiencing anxiety disorder are feeling of fear, anxiety and worry that are difficult to control, not being able to sleep, insomnia and often nightmares. Easy to have sudden panic attack such as shortness of breath, chest pain, increased heart rate, dizziness and headaches. Specific phobias, which the fear of height, flying spiders and clowns that interfere with everyday thinking. Symptoms such as sweating, shaking, digestive issue that refer to nausea, stomach pain or diarrhea. Most of anxiety disorder will avoid social situation because the fear of being judged by others and easily feel embarrassed. In other words, low self-confidence.
Next, I'm going to continue with the treatment for melancholic depression disorder. Firstly, doctor will give tricyclic antidepressant medicines (TCA) to melancholic depression patient. This drug aids in preventing the brain natural production of serotonin, which raises level of this good mood neurotransmitter. Next, the treatment is called electroconvulsive treatment (ECT), may be used to treat the symptom with melancholic depression characteristic in severe situation. In order to induce a minor seizure, electrode are attached to the head and electrical impulse are sent to the brain. Lastly, talk therapy is routinely scheduling meetings with a therapist to talk about symptoms and associated concerns. Moving on to the next treatment, which is for anxiety disorder, which is called CBT, cognitive behavioral therapy, which is offered a short-term treatment, teaches patients with anxiety disorder particular method to help manage their symptoms and progressively resume the activities they have avoided due to worry.
How's the life with major depression disorder? As an individual suffering from melancholia may have lost interest in their hobbies. They might feel like having social isolation due to the stigma surrounding them, which mean experiencing loneliness, emptiness, and struggle to find joy and happiness in their life. Some of them facing the appetite swing, either lose appetite or increase appetite. Having melancholia disorder may cause trouble falling asleep or insomnia or oversleeping, in which a person might sleep longer than usual at night or during the daytime, referring to the symptom of melancholia. In order for a change in mood, tiredness can also be described as one of the symptoms that The person might have low motivation to perform daily tasks and difficulty concentrating on the people surround them. Other than that, individuals with depression will always blame themselves for their mental health and feel guilt to other person around them.
Although anxiety is a common feeling for everyone, individuals who suffer from anxiety disorder frequently experience extreme and overwhelming fear and worry. And these fears and worries are usually followed by physical tension and other behavioral and cognitive symptoms which are hard to control. Furthermore, anxiety disorder can render daily tasks challenging. Due to the persistent fear and worry, individual might find it hard to do simple tasks such as going to school or work, conducting errands, and also participating in social events. Anxiety disorder can also lead to sleep disturbance that result in restless or insomniac nights. Inadequate sleep not only will worsen the symptoms of anxiety, it also can affect physical health, such as experiencing headache, weaken the immune system, and also less focus. This will affect their productivity and performance in their daily activities as well. For example, students who suffer from anxiety disorder may find it difficult to complete both individual and group assignments, as it is hard for them to participate in group as well as interact with teachers and friends in school.
Next, I'm going to continue with a 5.0, which is the effect. A person suffering from a melancholic depression may find it difficult to function in relationships. Melancholia depression can cause a person to feel exhausted, lose interest in social with their partner, or lose interest in activities that they used to love doing together. People may feel guilty or humiliated about this because of how their relationship is being affected by sadness. They could feel that they are burdened to their relationship or that they are blamed for their symptoms. Next, melancholic depression disorder can have an effect on their work performance. The majority of persons who suffer from melancholy sadness show a total lack of eagerness in everything they do together, with a slowing down of their voice, opinions and movement. Thus, this symptom will have an effect on their work performance, as they cannot voice out their ideas and opinions really well.
For now, I'm going to mention about the effect of the anxiety disorder. First and foremost, a common sign of anxiety is decreased communication. People who suffer from anxiety may find it difficult to communicate with others. They may avoid interaction or limit their communication to only the most important message. While decreased communication might be a coping tactic for persons suffering from anxiety, it can also have a negative impact on relationship. Next, increased argument also the effect of the anxiety. Anxiety can also lead to more fights in relationship, which anxious people may have difficulties regulating their emotions, resulting in more frequent and violent arguments with loved ones, family, and friends. They may be more likely to engage in confrontation as well, because anxiety might make them effortless, triggered, and defensive. Next, fear of abandon is another typical anxiety symptom that can have a substantial influence on relationship. People who have anxiety may fear their loved ones will abandon them or reject them, leading to a widespread dread of abandon. Because of this fear, they may cling to relationship. They will become too reliant on others and engage in action that drive loved ones away. Last but not least, the avoiding of social interaction is also another effect of anxiety disorder. This is because avoiding social interaction is a frequent anxiety symptom that can have a substantial influence on daily living. People who suffer from anxiety may feel uneasy or overwhelmed in social situations, prompting them to shut down entirely. This might make them maintaining relationships, participating in job or school activities, and attending community events difficulty. That's all from me. Thank you.
Hi, it's me again to talk about the factors that may have caused Justine and Claire's depression and anxiety disorder. So in the movie, Justine and Claire, they experience significant psychological distress due to many factors. The first one being family dynamics. So they have a strained relationships and also poor communication, which can lead to discomfort and also emotional distress. Next, we have social expectations. So Justine's she's struggling with balancing her goals with her cultural expectations around gender roles. It's a reflection of her struggles in the movie, right? So this pressure to conform to societal norms can also contribute to mental disorders. Moreover, personal coping mechanisms also play a significant role in their psychological states. Just like Justine, she uses self-destructive tactics to deal with her inner demons, such as putting off her obligations and undermining her happiness, while Claire initially copes with the catastrophe by denying its consequences and avoiding conversations about it, which may not be suitable in the long term. So overall, the movie it highlights the complex interplay between family dynamics, social expectations, and also personal coping mechanisms in addressing mental health issues. So that's all from Group 5. Thank you.